Hello, and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, Family Nurse Practitioner, and owner of Wells Legacy Health and Wellness. As I have been alluding, we have some major announcements to make. And so I'm going to make those announcements tonight, major announcements for us. We are now accepting Cigna, Aetna, Blue Cross Blue Shield, TRICARE, Humana, Medicare, and Medicaid, and some others. So if you or someone you know are looking for a new healthcare provider, you've called around and there's a 3 to 6 month wait for an appointment. We have same day appointments. Yes, same day appointments. We also offer early morning, like before you go to work, early morning, evening, and weekend appointments. Yes, evening and weekend appointments. So if you know someone who is looking for a new healthcare provider, primary care, give them our information. Our number is 321-306-6755. We're also offering some new services. We're offering medical weight loss. So we're partnering with the community and those in the community to help with getting healthy and maintaining their weight and reaching their goal for their weight. Different options in regards to that. So reach out if you have questions about that. Also, we're offering men's and women hormone replacement therapy, as well as coaching and just support in those areas. So reach out to us. We're here to service you on all of your healthcare needs. We provide the full spectrum of family practice services. So give us a call. If you're not sure if we're accepting your insurance, give us a call. If you know of a family member or a friend or colleague who's in need of any of the services that we offer, have them call us so that we can get them scheduled today. I am so excited. We're growing, we're expanding, and I need your help with getting the information and getting the word out there about Wells Legacy Health and Wellness. So please share. Tonight, we are discussing men's health and specifically men's mental health. We just celebrated Father's Day, so happy belated Father's Day to all of the fathers and the father figures within our community. I want to take a moment to honor the hard work that you all put in for your families and your community. We see you, we love you, we need you, and you are so important and a vital part of our community and our family. So thank you for all that you do. Tonight, we're going to be discussing mental health in men. And I feel that this topic is poignant and it's very important, especially during this time. We have just the climate of our society where we are right now. There's a lot going on, and there's so many pressures that are placed on the men in the communities, especially those minority, the Black and brown men, and those who are fit within the minority populations are having a lot to deal with. And when we think about what's going on in our society and in our country right now, families are being separated, husband from wives from their mothers, and fathers from their children. There's so much that's going on. So I wanted to take a moment to honor the men and their role that they play. My father, my husband, my uncles, and all the men that I know. I appreciate you, and I'm grateful for your presence. So tonight we're going to be talking about mental health in men. And the goal of tonight, several goals. One is to raise awareness about mental health, specifically for men. We talk about mental health in women all the time. Women are a lot more open when it comes to talking about their mental health and the challenges that we're dealing with. We get together with our sister friends, our girlfriends, and we talk. We just kind of let it all out. And we know that we have a safe space. We need to make sure that the men have the same. And so reducing the stigma around speaking out and seeking help is another reason why I want to talk about this tonight. And then to also highlight the symptoms, the treatment, and then resource options that are available to men in the community. And maybe you are a wife and your husband is struggling in a specific area and you don't know how to help him. Maybe something that I say tonight will provide you with the resources and the information that you need to be able to advocate for your husband or your brother or your father or one of the male figures in your life, and then to encourage open and open dialogue and community support where we rally around the men in our communities and make sure that they have safe spaces, make sure that they have what they need to feel safe to talk about the issues that they're dealing with. And so I want to, one, welcome you all to this live, and I want to make sure that the men have what they need. It's so important. So I have many different things I want to talk about tonight and highlight, but those are some of the goals that I have for this live tonight. When we think about men and mental health and the men within our community, there is a stigma around mental health in men, and it often goes unspoken because of that. So it's so important that we talk about it. So tonight we're going to talk about it. So if you are a wife, you are a sister, a daughter, a cousin, a friend, and you have a male in your life, a man in your life that is dealing with some of these issues, someone in your family, a colleague, hopefully something that I say tonight and you're a woman that's watching this will provide you with the information so that you can advocate for that individual. It's so important that they have someone to advocate for them and to be a safe space for them. We just celebrated Father's Day, and when I think about the number of men in the United States and the percentage of those men who are dealing with mental health issues, the numbers are astounding. While women are more likely to be diagnosed with depression, men are more likely to die by suicide, often because their symptoms are either unrecognized or untreated. And many times, men are able to hide their symptoms, or depression shows up a little differently in men. It doesn't look like the traditional depression. It could be overworking, sleeping, saying that they're tired, things of that nature. But we're going to talk about that tonight. Depression. One of the top conditions that men face and deal with is depression. And when we look at statistics, over 6 million men suffer from depression annually in the United States. 6 million. That's a lot. But a large percentage of those men don't get treated, and their depression goes untreated. And then it leads to suicide because they don't know how to manage those symptoms. They can no longer keep up with the symptoms that begin to take over their life, and they begin to feel hopeless, and they begin to feel like they have no outlet. And there is hope. There are resources that are available that can help these individuals. Signs in men of depression is anger, irritability, substance abuse. They're treating themselves, right, with drugs, isolation, physical pain. And what I mean by treating themselves with drugs is that they are treating their symptoms. They're self-treating. They're having anger. They are having anxiety, and they self-medicate is what I meant to say, with medications, drugs, things of that nature, over-the-counter meds, illicit drugs to mask the symptoms that they're feeling. And there's some different therapies that are available for men who are dealing with depression. There's antidepressant medications, there's therapy, talk therapy, cognitive behavioral therapy, there's support groups, there's lifestyle changes, especially if there's substance abuse involved or drug abuse involved, or alcohol. Many individuals don't understand that certain drugs are depressants, and it causes these individuals to feel depressed. And so if they're already depressed and then they're putting on top of that the use of illicit drugs or alcohol, it's just making the symptoms even worse. When it comes to anxiety, 1 in 5 men experience anxiety in a lifetime. I can recall a gentleman very close to me was on a trip, and they were doing some scuba diving. The friends were doing scuba diving, and he went to go do scuba diving with the mask, snorkeling with the mask on, and began to experience some symptoms, and said, "Is this what anxiety is? Because I've never felt like this before." They were in essence having an anxiety attack in the middle of the ocean, surrounded by people, but for whatever reason, was having an anxiety attack about getting in the water. And it can happen to anyone at any time, but didn't know what was happening to him. And so, surrounded by supportive friends, and family, he was able to kind of get through that and enjoy the rest of the trip. But just out of blue, it happened. It had never happened before. Excessive worrying, restlessness, muscle tension, sleeping problems are some of the ways that anxiety can show up in men. Eating too much, eating too little, sleeping too much, not sleeping enough at all, or a feeling of impending doom, like something is just going to happen and just something's happening. I don't know what it is. Always looking over their shoulders, always worried that something is going on or something has happened or something's going to happen to a loved one or things like that. And there are many different things that can bring that on if there were past traumas and things of that nature. But sometimes just because of the load and the burdens that they carry and the weight that they carry, it can be anxiety provoking at times. Some of the treatments, again, there's medications that can be utilized. There's different therapies that can be utilized, tapping, focusing on different things, deep breathing, mindfulness, yoga, things of that nature. And exercise can also help. When we look at substance use disorders, men are 2 times more likely than women to misuse drugs and alcohol. And as I mentioned, drugs and alcohol can be a depressant. And if individuals are dealing with certain symptoms already, and they add on to that use of marijuana, different drugs, whether it be prescription drugs, which we're seeing a lot of prescription drug use in men, whereas previously it was more so in women, the numbers have begun to kind of level out a little bit when it comes to that. Signs of this is increased use, substance abuse, inability to stop, neglect of responsibilities, or risky behavior. We see a lot of motor vehicle deaths and a lot of accidental deaths due to intoxication and drug use. And then we're seeing, which I think the numbers are going down when it comes to overdoses, but we're still seeing overdose deaths from drugs. Thank goodness we have Narcan so readily available in the community to where if individuals are found to be overdosing in the midst of an overdose, or someone finds them unresponsive, there's a high likelihood if we can get Narcan on board and get them some treatment and CPR that we're able to save that individual's lives. We're seeing those numbers increasing. And since COVID, we, especially during COVID, there was a marked increase in it. And then years to follow, still the same. And so treatment for that is detox, rehab programs, again, therapy, medication, the naltrexone, which is Narcan. And there's some other therapies that are available as well that can help individuals who are dealing with drug abuse or drug use. And it's important that we know what's available so that we can help these individuals. When I talk about trauma, and I spoke about trauma just a little bit earlier, that it can be anxiety producing and provoking. Post-traumatic stress disorder, meaning these individuals have had a traumatic event that's happened in their life at some point. And I read this book, The Body Keeps the Score. And it talks about how when we have these traumatic events in our life, we can tend to move on from them. However, our body stores those memories. And when something comes up that triggers a stress response or something similar occurs, let's just say someone was in a car accident. In the book, they were talking about this husband and wife that were in a car accident. And it was a pileup. And there was like major cars involved in there. And there was a lot of deaths that occurred. And they were one of few people who survived that accident, whereas everyone else around them died in this accident. And they dealt with traumatic stress, post-traumatic stress disorders for years and had to go through extensive therapy to be able to deal with it and live normal lives. But things that happen in men from childhood or at any point, the loss of a loved one, some type of abuse, some type of trauma that occurred, violence towards them, or they witnessed violence. And when we look at history and we look at children who were born in houses where drug use was there, poverty, there was abuse, domestic violence, things of that nature, those children hold on, their bodies hold on to those traumas. Even though it didn't happen to them, they were in the environment. And so some of the treatment or some of the signs of this is nightmares, flashback, avoidance. They avoid going into situations that are similar. They avoid going to certain places. They avoid having conversations that may elicit or bring back up those memories. Hypervigilant. I mean, they're always looking over their shoulder. They're constantly surveying the environment, things of that nature. And then emotional numbness. They are unavailable emotionally because that's their protective mechanism, is to disconnect emotionally so that they don't have to feel, that they don't have to revisit those feelings and those things, those emotions that occurred when they experienced this trauma or what have you. And especially with first responders, abuse survivors, and yes, men can be domestic violence victims. We don't see it as much, or we don't hear it as much, but believe you me, I've seen it. I've worked with men who've come into the emergency room that have been battered by their significant other, male and female, and or their partners, and have dealt with post-traumatic stress because of it. And veterans, of course, we know, but anyone can suffer from it. But men do deal with these things many times, especially, as a little girl, I looked up at my dad and I thought he was Superman, that he can do anything and that nothing impacted him. And I'm sure my daughters look up to my husband the same. But we have to realize that they are human and they have emotions and they deal with some of the same things. So treatments, trauma-focused CBT therapy, cognitive behavioral therapy, peer support, talk therapy, different types of therapies and support groups are available for individuals who are dealing with post-traumatic stress disorder. And if these individuals are victims of a crime, Victims Advocate is a great place that's able to support them and to help them and the family to kind of work through these seasons and these moments when those stressors begin to become too much. Suicidal thoughts. Men are 4 times more likely than women to die by suicide. And some of the signs can be subtle, little things that they say that aren't very obvious, but they're letting us know, right? And we just really have to listen and pay attention. They're talking about death, grim things they're talking about. They start giving away possessions, hopelessness, sudden calm after depression. They were severely depressed and now all of a sudden they're really eerily calm. And then sometimes there's no sign, right? We see often, and there's so many things that are talked about on social media, and usually it's celebrities. We've seen over the years several celebrities, many celebrities ending their lives to suicide, just out of the blue, or so people think it's out of the blue, but they were given signs all along and no one paid attention to it. So we really have to pay attention to the individuals, the men in our life. Notice the changes in their behavior. Notice the change in their pattern. Notice when something's not right, when their speech or their vocabulary or tone has changed. We need to pay attention to that. Many of us are so on autopilot. We get up every morning, we do the same thing. We go to work. Hi, I love you. Good night. Have a good day. Blah, blah, blah. Keep moving. We really need to pay attention to the individuals around us. So if we know someone that is having active suicidal thoughts, 988 or visit to the ER. We've seen in a very recent, in my area, there was just, I believe, last week or the week before, an individual who was having a mental crisis and 911 was called. And this individual did not leave that house alive. I'm not saying not to call 911. I'm saying pay attention to the signs so that we can prevent from it getting to a point where 911 is called and things don't end well for that individual. Whereas they're in a mental crisis and they end up losing their life because they're not fully there and they do something to threaten the officers or what have you. I don't know. And I'm not bashing police. We are a police family. We have police in our family. I believe that not all people are bad people, and I don't categorize people, right? And I would never do that because not all people are bad people. We don't know all of the scenarios and situations that happen. We only see what the media shows us. However, I know in past there have been the mental health SWAT groups that have come out instead of police or in conjunction with the police to help individuals who are dealing with mental health crises so that they can get the help that they need and a safe surrender happens and they are able to get the help that they need mentally for themselves. But before these individuals get to that place, 988 and then a visit to the emergency room. And if 911 has to be called, make sure you're giving all of the information to let them know what's really happening. And so they're not coming in blind, not knowing what's going on. Why men often don't seek help. There are so many men that don't seek help. Why is that? The stigma. Real men don't cry. It's been in culture for years. Dry your face. What are you crying for? Boys don't cry. Men don't cry. We don't show emotion. Well, you should. And it's important for men to show their emotions because anything that's under pressure too long is going to explode. If you think about a soda, you got a bottle of Pepsi or Coke. My sister loves Coke. So you got a bottle of Coke and you shake it up, right? Every day, this man is getting up, going to work, and they're dealing with things, dealing with different stressors, and then shaking them up. And so the pressure begins to build and build and build. What happens to that Coke? What happens to that bottle? Eventually, it's going to explode, right? When you think about a crock pot, you put things in this pressure cooker, and over time, you have to release that steam or that pressure, or it's going to explode. And that is literally what happens to individuals who are dealing with extreme amount of stress. They just explode. And then people are looking like, well, what happened? It just happened overnight. It didn't. We just weren't paying attention. Fear of seeming weak and vulnerable. And I think I mentioned it before. Seeking help is a sign of strength, not weakness. Being vulnerable is a sign of strength, not weakness. And lack of representation in the mental health spaces. We're seeing more and more and more minority men that are going into mental health counseling and therapies to be able to help men who look like them. And so it's important, especially for certain cultures, that we have representation. So if you or someone you know is looking to go into a career, maybe think about mental health. Maybe think about therapy or counseling or support groups, volunteering your time to help in church, within the community. It could save a life. And then fewer male-focused resources. When I first started in nursing, I was big on providing resources, as I always have been. And when I would look for resources for men, shelters for battered men, mental health for battered men, or for men in general, there weren't as many as there were for women. I'd have a big folder full of resources for women and 2 sheets or 1.5 sheet for men. So we have to do better as a medical community, as mental health providers, and as a society to make sure that there are resources available for the men. I want you to think about something, and I want you to share this with men. I often talk about our cups, right? That I can't pour from an empty cup. And then I heard this phrase that our cups should never be empty, because if our cups are empty, then we're not doing something right. We're doing something wrong. And I want you to think of this. Instead of saying what's wrong with that person, what happened to them? Because normally we're reacting to something that happened to us, something that occurred, some type of trauma, some type of encounter. It's not what's wrong with the person, but what happened to them. And when I read that book, The Body Keeps the Score, that helped me to reframe the way that I think and the way that I view and the way that I perceive people and their responses to me or to other people. Instead of me thinking of what's wrong with them, what happened to them. Asking for help is a sign of strength, as I mentioned, not weakness. And you can't pour from an empty cup, but our cups should never be empty. We should always be filling our cups up, doing the things that cause us to be whole and fulfilled, doing the things that make us happy, doing the things that cause us joy. So what's one thing that causes you joy? Men, if you're watching this, women, if you are near or you have a friend that's a male family member, what have you, that is a man, share this with them or ask them that question. What brings you joy? What hobbies do you have that fill your tank? At the end of the work week, what is something that you want to do that kind of fills you up and restores you? Treatment options and self-care. Seek professional help. Therapy. Right now, therapy online is the way to go. There's so many mental health providers, and there's so many, and I'm excited about this. Every day I'm meeting a new provider who's a mental health nurse practitioner who's gone back to school to get that extra training and education to be able to help this community so that there's good representation or a higher representation of minority mental health providers. And so online therapy is the way to go. Psychiatry, and then also your primary care checkups. When you go to your primary care provider, they should be asking you some questions about your mental health. And there's 2 questions that we ask. In the last 2 weeks, have you felt down, hopeless, or depressed? Or had a lack of energy or lost interest in doing something that you used to enjoy? Based on those 2 questions, as I mentioned previously, we'll then ask some additional probing questions so that we can get to the bottom of what's going on with you. And please be honest. Be honest. When I'm in with my patients, we have some honest, raw conversations. And I can tell when someone's not being honest. And I can only help you if you're being honest. And that's the only way to get to the bottom of what's going on. So some other resources for men, you have the men's group, the online forums, faith-based group. So if you're a part of a church, reach out to the leadership or other, the leaders in the church to see what's available, how you can get connected to other men so that you can have a way out. Self-care things, practices that you can put into place. I don't know about you, but I love journaling. I know that there are some men who journal and write their feelings. Exercising, balanced diet, meditation, and then limiting alcohol and substance abuse or substance use. And then routine healthcare checkups. As with women deal with menopause. Men also go through something called andropause, and it's where their testosterone levels begin to decrease. And we see a heightened number of men whose testosterone levels are decreasing begin to experience anxiety and depression. And so instead of just throwing a pill at someone, we really need to look at the whole person holistically, every part, to figure out what's going on. And if it's the low testosterone, we can help you because we provide that service. We do provide testosterone replacement therapy and hormone replacement therapy for men and women. So getting your blood work done, asking your provider to do these blood work, these levels, your hormone levels with your routine blood work if you're experiencing symptoms. And then there can be some chronic conditions that could mimic mental health illnesses. So really knowing what's going on and getting to the bottom of them. So what are some tangible resources and things that I can offer for you tonight? Can't pour from an empty cup. The suicide hotline is available, 988, I'm sorry. You can call or text 988 24/7, 365. Someone's going to be there to talk with you. We have the National Alliance on Mental Health, or NAMI.org. We have headsupguys.org. It's a mental health support group for men. And then there's mentalhealth.org. And these are resources that loved ones of men who are dealing with mental health issues can look at and look to for support. And then you have SAMHSA, which is a helpline, and that's 1-800-662-HELP. 1-800-662-4357. I have a call to action tonight for you. If you or someone you love is struggling, don't wait. Reach out today. Wells Legacy Health and Wellness, while we don't specialize in mental health, we have experience. I have years of experience with individuals who have mental health, and I'm able to manage certain things to a certain degree, right? But as it gets more complex, then we will reach out and get those individuals scheduled with a provider who is specialized in treating that particular condition. But if you're not sure what's going on and you need an evaluation, we can help you. Give us a call. I encourage you to check in on your male friend this week, your husband, your brothers, your uncles, your colleagues, your neighbor. Check in on them. See how they're doing. Ask them the question, how are you doing? Is there anything that you want to talk about? Give them that open dialogue and that opportunity to share. And many times it's just a matter of asking. Someone is just asking, waiting to be asked, are you okay? Do you need to talk? I invite you guys to comment or message me privately if you need some referrals or if you know of someone who's struggling and needs some help. Reach out to us. Our number is 321-306-6755. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Again, I'm excited. We are accepting insurance. If you missed the beginning, we're now accepting Cigna, Aetna, Blue Cross Blue Shield, Humana, TRICARE, Medicare, and Medicaid. And we're offering new services. We're offering medical weight loss, so we can partner with you on getting to your goal weight or maintaining your current weight, as well as men and women hormone replacement therapy. So share the news. Reach out if you need help. We're here for you. Until next time, stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Have a good night.